A nurse noticed the patient teaching about cholesterol was effective by which patient comments. A. I will focus on increasing my VLDL and decreasing the HDL and LDL. I will focus on increasing my LDL and decreasing the HDL and VLDL. C. I will focus on increasing my HDL and LDL but decreasing the VLDL. Or D. I will focus on increasing my HDL and decreasing the VLDL and LDL. Please subscribe. Alright, the answer is D, because the goal for HDL is to be high and the LDL and the LDL to be low, and we want to be below 200. So lipids are comprised of VLDL, very low density lipids that are bad, really bad, and then LDL, which are also bad, but good HDL, high density lipids. So the ratio of high density lipids to low density lipids, with high being greater, is the best predictor for development of, if you have a low amount of HDL, will develop and a high LDL will develop into cardiovascular disease. Again, subscribe so I can get 100 subscriptions.